Welcome back to Find That Code with the Coding Corner. In this session, we're talking about cardiac catheterizations and how they differ from simple angiography. We'll walk through the left heart cath, right heart cath, and combined procedures and how they impact your code selection. Today's agenda includes what is a cardiac cath, angiography, left heart, right heart, and real-world examples. A cardiac catheterization means we are advancing a catheter into the heart itself to gather hemodynamic data, look at pressures, oxygen saturation, and sometimes to perform an intervention. That's a very different intent than a straight diagnostic angiogram that's only about imaging the vessels. When the physician is only doing an angiography, they're injecting contrast and taking images of the coronary arteries or great vessels. The catheter may be in the vessel, but it's not entering the heart chambers for pressure measurements. Your codes here are focused on the imaging service, not the heart cath. For left heart caths, the key features here is that the catheter is actually crossing the aortic valve, and then we get the left ventricular end diastolic pressure, and that's when you know that you have crossed into the left heart itself. Sometimes a ventriculogram will also be documented, but not required. A left heart cath starts with arterial access, use femoral or radial. We measure aortic root pressure, then we cross the aortic valve into the left ventricle to record the left ventricular pressures. The pulling of the catheter back helps to check the aortic valve gradient. If the coronary angiography is done, use 93458. If graphs are imaged, use 93459. Otherwise, the basic left heart cath 93452 is billed. A right heart cath usually starts with a venous access route like femoral or internal jugular vein. The catheter is advanced through the right atrium, right ventricle, and into the pulmonary artery. And you'll see detailed pressure and saturation data for those structures. That's the clue that this is the right heart cath, again, separate from just imaging. A right heart cath uses venous access, usually jugular, subclavian, or femoral. We measure right-sided pressures, the PCWP, which checks oxygen saturations and calculates the cardiac output using Fick or thermodilution. If coronary angiography is done, use 93456. If graphs are imaged, use 93457. Otherwise, use the basic right heart cath 93451. And if you were wondering what PCWP is, this is measured during a right heart catheterization by wedging a balloon-tipped catheter in the pulmonary artery branch, providing an indirect estimate of left atrial pressure and left ventricular filling pressure. Sometimes the provider performs both a left and a right heart cath in the same session. The note will clearly walk through both sides of the heart, and you'll see both venous and arterial access, plus pressure data for both the right and left chambers. In those cases, we look for combined left and right heart cath codes, not two separate standalone codes stacked. In this example, we're looking at a typical left heart catheterization performed through the right radial artery. A 6 French sheath is placed, and the diagnostic catheter is advanced up the aortic root. And at this point, we record the aortic root pressure. This gives us our baseline before crossing the valve. Next, the catheter is advanced across the aortic valve into the left ventricle. Once we are in the left ventricle, we obtain both systolic and end diastolic pressures. These values help us to understand left-sided filling pressures and ventricular performance. A pullback maneuver is then performed. As we withdraw the catheter from the left ventricular section back into the aorta, we check for trans aortic valve gradient. In this case, no significant gradient is present, which means no evidence of aortic stenosis. Selective coronary angiography is performed of both the left and right coronary arteries. The patient has no bypass grafts, so graft imaging is not part of this case. The findings show a mildly elevated LV EDP, no significant aortic stenosis, and no obstructive coronary artery disease. Because coronary angiography was performed alongside the left heart cath, the correct code would be 93458. In our next example, we're looking at a right heart catheterization performed through the right femoral vein, paired with a coronary angiography through a separate arterial access site. We begin by placing the 7 French sheath into the right femoral vein. A Swan's-Ganz catheter is advanced through the right atrium, right ventricle, and into the pulmonary artery. At each location, we record right-sided pressures to evaluate how the right heart and pulmonary circulation are functioning. A pulmonary capillary wedge pressure is obtained, which helps us to access the left-sided filling pressures. We also collect oxygen saturation samples from the SVC, RA, RV, and PA. These saturation values help to identify any abnormal mixing of blood or potential shunting. Cardiac output is calculated using thermodilution, giving us a measure of how effectively the heart is pumping forward. Next, we establish the arterial access in the right femoral artery to perform the selective coronary angiography. A diagnostic catheter is advanced to the aortic root, and both the left and right coronary arteries are imaged. The patient has no bypass grafts, so graft angiography is not part of this case. The findings show elevated pulmonary artery pressures, a moderately elevated wedge pressure, no evidence of a shunt, and mild non-obstructive coronary artery disease. Because this case includes a full right heart cath plus coronary angiography, the correct CPT code is 93456. Okay, everyone, that concludes today's the Coding Corner coding sessions. If you would like to find out more information about our sessions, contact us at thecodingcornermce@gmail.com, or if you would like to book with us, you can book with us at thecodingcornermce.com.